Welcome to the Getting Started with Duette program. This presentation will cover tips for success at the follow-up appointment. I'm Dr. Jim Kirchner, and I'm Senior Vice President of Clinical and Professional Services at Synergize. Prior to joining Synergize, I founded and spent the majority of my career in a multi-doctor, multi-location practice in Lincoln, Nebraska. I saw firsthand how the Duette family of lenses gave my patients the best possible vision while helping to differentiate my practice and build a recurring revenue stream. I'm excited to share this information with you today. So let's get started. We found that a 2-week follow-up appointment is ideal for Duette HD and Duette multifocal patients. By the 2-week mark, your patient will have had plenty of time to adapt to the lenses, which will give you a true picture of how the lenses are working. When your patient comes in for the follow-up visit, make sure they've been wearing their Duette lenses for at least 2 hours. It doesn't give you any reliable information on the lens fit if the patient arrives with the lenses in hand or on the eye for a lesser amount of time. Take a detailed history, carefully documenting any discomfort or vision concerns. Then check acuities at all distances and assess lens movement and patient comfort. You'll also want to evaluate the cornea and other anterior ocular tissues. The follow-up appointment for Duette lenses shouldn't be any different than it would be for a soft lens patient. So follow your typical protocol for assessing a contact lens patient at the 2-week point. And remember, if the patient doesn't have any complaints, don't make any changes. If you find that you need to make a change at the follow-up, there are a few key principles to keep in mind. If the patient reports blurred vision, first check to see if the prescription has too much minus. It's very easy to over-minus a Duette lens due to the aspheric design of the RGP center. Second, check for possible residual astigmatism, which can cause blur. Duette lenses are not designed to correct lenticular astigmatism, so if you're seeing residual astigmatism, the patient may not be an ideal candidate for the lens. Now, if you find that you need to make some changes to improve comfort or movement, simply apply soft lens principles and adjust the skirt curve. Steepen the skirt to tighten the fit, and flatten the skirt to loosen the fit. And finally, if spectacle blur is an issue, flatten the base curve. If you're fitting a Duette multifocal patient, there are several changes you can make to improve vision at near, distance, or at intermediate. Remember that your starting point is a large zone in one eye and a small zone in the other. If the patient complains of poor near vision, consider adding plus to the non-dominant eye. If that doesn't resolve the problem, try a large zone OU. If distance vision is not ideal, first try small zones OU. If the patient still has a complaint about their distance vision, try a Duette HD in the non-dominant eye. This will give them crisp distance vision, while the aspheric design of the HD lens will give them greater depth of focus to keep the near vision sharp. And if the patient has issues with their intermediate vision, consider adding plus to the non-dominant eye. If they're still blurry after making that change, try large zones OU. Let's now talk about what you should do if you see a Duette lens that doesn't move as much as you think it should. First, determine if the lack of movement is accompanied by discomfort. If the patient reports discomfort, you probably got a tight-fitting lens, and flattening the skirt will loosen that fit. If the patient is already wearing the flat skirt, move to the next flatter base curve. But be careful not to go flatter than the flattest K. If the patient is not uncomfortable but you see that the lens isn't moving, the issue is probably a dry skirt caused by environmental factors. In this case, you'll need to instruct the patients to add a few drops of saline before removing the lens. Let's spend a moment talking through what you should do if you see filming or fogging on a Duette lens. There are several causes of filming and fogging, which includes a fit issue, environmental issues, and solutions or cleaning habits. If a Duette lens is fitting too tight, you'll get tear stagnation beneath the lens, which can cause filming and fogging. If you determine that the fit is the cause of the problem, flatten the skirt curve. If the patient is already in the flat skirt, flatten the base curve, again, being careful not to fit flatter than the flattest K. If the lens fit is not causing the filming or fogging, look at the patient's daily routine. Are they using cosmetics, soaps, or lotions that could be getting on the lens and causing a film? Remind your patients how to properly handle their lenses as they go through their daily routine. And finally, filming and fogging may be caused by a solution reaction. If your patient is using a multi-purpose solution, you may consider moving them to a peroxide system such as ClearCare. You may also recommend that they use a soft lens daily cleaner as a part of their care regime. Any solution that is approved for use with silicone hydrogel lenses is fine to use with Duette lenses. We at Synergize are committed to giving you every possible resource to ensure your success. We have a team of technical consultants available throughout the day to answer questions and to help you achieve positive outcomes. You can reach them by phone at 877-733-2012 at option 2. You may also email consultation@synergize.com and someone will get back to you as quickly as possible. This concludes the Tips for Success module. We appreciate your time and attention. Please feel free to go back and review any of the previous modules or call our consultation team with questions. Thank you again for your time and interest in fitting Duette lenses.